My name is Enoch. I'm a psychiatric nurse, also my therapy center. And today we are going to learn something about ethical principles in psychiatry. So the definition is, these are just fundamental guidelines that ensure patient well-being and respect for individuals' autonomy. And there are the vital things that can make our professional work. So the first one we go, the autonomy. Autonomy is ability of everyone to express themselves, like making freedom. You want to express yourself in a certain way, depending on the condition of the client. Maybe I can say, maybe the client that is advocated, maybe the next of kin or anyone who is standing for the patient. We can call, nowadays we call them clients. So then the second one is non-maleficence. Non-maleficence is the ability to cause non-harm, like the client should remain harmless. There is no, especially when you are making the procedures, for example, like placing the granula or administering medication through the parenteral route. Maybe they're doing injections. Maybe you want to give an IV injection. So like you have to minimize the injuries to the patient. Those are a physical harm. Then also there is also psychological, like causing violence to the client in any way that is unprofessional. It is also discouraged. That is not good. So it should be non-maleficence to the client. The third one we go by the beneficence. So as you are benefiting from your professional or maybe work, you have to ensure that the client also benefits. The next of kin and their parents also benefit, as well as you also benefit. So it should be a mutual benefit between a health worker and the client. So the fourth one is justice. Everything that you do should be fair. You have to do fairness in all the way. It is a very professional ethical principle. Then the fifth one is confidentiality. This is the ability to give information, like to privacy. You have to give up the privacy of the information. So you have to take, after you take the history, for example, you can take like when the client had a history of, there's some conditions like HIV, or maybe there's some diseases, or maybe there's a certain thing that they commit. Maybe they have a history of like, maybe they have a forensic history, maybe they have been arrested for some times for causing a certain crime. So you have to ensure that trust so that they give you the full information, and the information that they give you, you have to be professional, like it should be confidential, to put in a very well private duplicates, and also to ensure that it is secure, not to share to anyone. That is a very good, and it is a very important thing. It is actually the main principle. Then lastly is fidelity. Fidelity is it is almost the same as it is on its own, but it is also this like honestly, like when you give out promises, you have to deliver. You should not promise something that is not guaranteed. Like you want to give out the promise and you don't recognize that, you don't remember that, giving out false. So that is not the way we should operate. As much as in profession we have something like delaying gratification, when the clients call out for something, there's something that you have to delay, that you delay their gratification. But we have to be honest. To give up, as you give up to specify a certain time, you have to ensure that they get. So you have not to tell the false. As much as you violate the fidelity, the client trust will be adamantly be lost. So you will not. The treatment process will not be as well. So thank you. The next episode will be in the different videos.